Yeah, I mean, it is a, a, a meaty subject, to be
Yeah,
honest.
I
So we've
appreciate
got
that.
several hours, but I'll
Yeah.
try and touch on a few. I think, the NHS is there for patients. So I think technologies that can improve patient access to their own records and their own care are pretty vital, and it would be up my, top of my list, such as patient portals or apps and things like that. I think though they still sometimes need a lot of help on how to use them. So that intuitiveness about what care you're being given, and then sort of transparent, sort of patient-centered sort of flows that you can easily share. So technology that makes it really easy to say, oh, I don't know if I'm going to go in for a knee operation, this is what I can expect to happen,
Yeah.
and really explain that. And a facility of being able to ask questions. Now, I don't see why, AI built into those platforms can't access a lot of and answer a lot of the questions. The power of AI is it can use multiple languages. So, a lot of people, English isn't their first language. So, thinking of technologies that takes that communication barrier away is really important. And AI, that's one of the things that we introduced. And I had a developer that was fluent in German, so you could talk to it in German, and it responded in German. But as the organization, they only needed to feed it, I guess English. So
Yeah, I
you
see.
didn't have the overhead of lots of translation, and it's real time and it's natural language. I think with a lot of these things, technologies that learn, that can you can analyze what's going on for the processes, and then so you can make data-driven quality decisions around safety and patient improvement and health. So integrating your EPRs with your reporting solutions or your BI solutions is an absolute critical for me.
Yeah.
The next step from that is taking those learnings and being able to feed them back into the EPR, so that it can learn to say, actually, maybe when you make this decision, there's an 80% success rate, or is a 20%. Do you know? So not only just having, because at the moment I think there's a lot of reporting is separate from the end user, and if you're maybe in the management or you're into those, you can read that, but it's about integrating, so you have that circle. So you're
Yeah.
putting the data in, and then the clinicians are getting the benefit. It's not to take away clinical decision making. That's really, really important. And AI has to be treated with, it's not the be all and end all, it's going to solve everything, but it
No.
can be there as a, phone a friend. It's really friendly to help back up maybe when you're thinking. There is a lot of uh, information and data in the NHS that probably isn't as used. So joining other organisations and looking at that sort of public health information, and how you look at what's going on in other factors like social areas and stuff that can impact the NHS, and how you build those up. Um, and I think just really to end on that, whatever it is that you're doing you need to really think about that patient-centered, user-friendly design. Um,
Mm.
so you can get, and I can get very carried away with it. But if I've got this brilliant thing, but people can't really get past the first one or two screens,
Yeah.
it's not going to engage people. You're not going to get those benefits. So taking some time, and what we did well with the in the EPR and T's Ask and Weir was we engaged patients in the process as well, and they helped design things. We've got this
Fantastic.
brilliant box which is called Useful Stuff, because we were trying to come up with all these clinical words, and a patient said, "Well, isn't it just useful stuff?" And that's what we called it. It's my favourite thing in the whole EPR.
Nice
But
and
it's a
simple.
good example of having patients involved in what it is you're
Yeah.
developing, because ultimately they're going to be the beneficiaries of that.
Yeah.